I would imagine that the first thing that comes to a parent's mind is, okay, they're cutting themselves and suicide is next, or attempted suicide is next. Does that happen?
So actually, in a study that looked at ERs in 2010, 713,000 people came in with self-inflicted injuries. Only 38,000 of them were attempted suicides. So that's about a little less than 20% of self-inflicted injuries that are actually with intent to commit suicide.
I'm sure the parents are always freaked out about this and concerned, but suicide, this is not a direct link. Suicide is not the very next step then.
No, usually, people who cut are cutting because they feel bad about themselves. They don't necessarily want to die.
Yeah.
They may struggle with feelings and ideas of suicide and want to die, but they may not actually have the intent, profound desire to be dead. They really have a profound desire to be connected to life, and they're struggling. They're struggling to make that connection.
Now, I've noticed that a lot of these children, their persona is not that of a depressed person. That often they're involved with sports, they do well in school, they present with a happy face, laugh and this and that. Is that true? And yet they still cut?
Yes. Yeah. Yes, the outward appearance of a teenager, for us, for adults, our standard for success is this feeling of this look of being happy, getting academics done nicely, having a good GPA, being active in sports, having a good social life. For teenagers, it's a little bit different. Their standard for doing well is how they feel at any given moment. And so while they're doing all these, what they would consider superficial kinds of activities, their profound soul, their profound feelings are really struggling.
And then this is a delivery system that's been around for decades, but sort of fell out of popularity and is now coming back again. It's a pellet, so it's basically bioidentical testosterone in a pellet, and this would be inserted just below the belt line on the hip, and the skin would be anesthetized. This trocar would be placed through the skin. It just goes in up to about this hub in the fat layer, and then the pellets, and there would be several of these, would be loaded in like so, and then this just a little plunger that simply pushes the pellets out.
And that doesn't hurt?
It's like going to the dentist. You do a little freezing and everything's fine, and this lasts about 5 or 6 months in men.
The next stretch that I highly recommend for just about everybody to do is called upper extremity flossing.
Okay.
And I know that sounds funny, but because we're slouched at a table all day, sometimes our nerves get entrapped in our muscles. So we want to be able to not only stretch out our muscles, but allow the nerve to move freely. So what we're going to do is we're going to sit like we're holding a giant beach ball with our shoulders relaxed. We're going to squeeze our shoulder blades together, extend our elbows, extend our wrists, and open up our fingers. You should feel that all the way to your fingertips.
How long do you hold it?
Just for a couple seconds, and we'll come back. Because we're working with the nerve there, we don't want to hold for too long. So we'll go ahead and do one more. Squeeze, open the wrist, and then the fingers. Take a deep breath. We like to breathe, and then come back to center and relax.
Oh, that does feel good.
The diet had a huge shift around 10,000 years ago when humans started doing agriculture, and agriculture included lots of carbohydrates. So humans, for as long as we've been around, have liked and hunted and ate meat. And about 10,000 years ago, we had this big change where we started eating carbohydrates. Again, the problem with eating modern meats today, the potential problem is eating too much and eating too much fat. So again, if you thought about game that you might catch naturally, probably be much leaner than the fats that are delivered to us. So again, we're designed to want to eat a lot of food, we want to eat fat, and in the modern world, it's very easy to get too much of food in general and too much of fats in particular.
Hello, Dr. Santora. This is John from Orange. And is there anything healthy about beer?
That's a great question. Beer has been around for thousands of years, and it has a lot of great qualities. Beer was thought to save humankind in the Middle Ages because it was the main beverage consumed by children all the way up to old age. Beer had a lot of medicinal properties. It got rid of the parasites, and it got rid of the bacteria in the contaminated water at that time. Today, we drink beer for lots of reasons. It doesn't matter if it's a light beer like this or a regular beer. They have basically the same beneficial properties. Light beer has a little less calories, maybe 100. Regular beer has about 150, and a little bit more alcohol. So it's basically barley, which is a grain, to which you add hops, which changes some of the fermentation process. You add water and then yeast, and it changes the sugar into alcohol and CO2. So what are these properties? The properties is the alcohol cuts the risk of heart disease by about 30%. It reduces the onset of adult diabetes. It can slow the progression of dementia and Alzheimer's. It can add to strengthening of your bones and preventing bone fractures. It reduces the onset of kidney stones. It can raise your good cholesterol, your HDL, and is shown to reduce the incidence of stroke in women. So it has all of these properties, and the USDA, the 50 studies have shown, and they have been examined by them, that if people who drank beer lived longer. So what is a beer? A beer drink for a woman is 1 12-ounce beer. You should limit it to that. For men, up to 2 beers per day. But you have to drink wisely and responsibly. You don't want to drink and drive, obviously, but you don't want to start drinking more than that, because as a woman goes over 1 beer per day and a man goes beyond 2 beers per day, then you start to get the bad effects of alcohol. So it's a great question. It's a great food to drink, but I would not drink it as a medicine. If you like it, feel comfortable, that you can drink it, and you're getting a lot of health benefits. Great question. Thank you for asking.
Well, this is one of the more traditional tools that we have used in the past. It's been around for several decades. It's a spring-loaded instrument, and it exerts a thrust. And you can see here, as I push on it, it's exerting a particular amount of force. And this, on the spine, allows the joints to get back into their natural motion. But it is very intensive. It's very difficult to use as a practitioner. You get tired after using it all day.
I imagine. Right.
And also, there's a lot more to this instrument that I'll show you here. This is one of the newer instruments. It also has a stylus tip. It's controlled electronically.
Yeah.
It has a pretension, and what this does is placed right on the joint, and we call this the facet joint.
So this is the patient's back right here.
So this is the patient's back here. If
Yeah.
they're lying down, for example, we would
right,
place the instrument over the area that's out of alignment or not functioning correctly. We put a little pretension and we pull the trigger. And it would exert a direct, a very specific thrust to the area. It does it at a very high speed, which reduces the natural tendency of the body to stiffen up. Because most patients, when they get adjusted, they become very stiff, they're afraid of the adjustment, and then we can't get the result that we're looking for. But the instrument is 100 times faster, according to the studies, than the human hand.
Can you turn it on? Can I see what it's like?
Yeah, absolutely. So here's an example I'll just show you on my finger here. As I put a little pressure, and you can see how my finger moves quite a bit, and we can vary the strength of the instrument as well. And that will open up the area here where the nerves come out and allow it to function a lot better.
So they come to you, okay, now you say, well, I think you have rheumatoid arthritis. What do you do next?
The next step is to order x-rays and also order laboratory testing. In the early onset of disease, your x-rays may not show any damage, which is good. Obviously, if your x-rays at the early stages show you have what we call erosions or damage within the articular cartilage, those patients would usually be treated more aggressively.
So there's value, and it makes helps with the diagnosis, but it helps with the therapy.
As well, correct. And it's also used for monitoring. So if once you're on treatment, especially with the new treatments, we've shown that many of these new treatments prevent the joint damage from occurring and progressing.
So you know if you're being successful, not only by the symptoms getting better, but by your x-rays not deteriorating.
Absolutely.
As far as cavities go, I have one question. So if you have the veneers on, does that trap bacteria so you get more cavities, or not?
Well, technically not. If it all depends on how your oral hygiene is. You have to still be flossing and brushing like you used to. This is very thin, and the space between the veneers and the teeth is minor, and it's always filled with a very strong cement that hold the veneer to the tooth. So if you're flossing normally and brushing normally, you're going to keep it in a good shape. If you're not, you're going to get a cavity like everybody else.
And if you have a cavity, you could your x-ray will go through that veneer so you can see there's a cavity underneath.
We can fix usually most cavities while the veneer is still on, which is really interesting. Unless you waited and the cavity is huge. At this point, we have to remove the veneer and fix the tooth and then maybe put another veneer on it or a crown, whatever it is.